I'll quickly try to look at the clinical manifestations of nephrotic syndrome. So, clinical manifestations of a disease condition is just another way of saying signs and symptoms. So, if a patient has nephrotic syndrome, how can I be able to identify? As a doctor, you're always supposed to make your diagnosis from the medical history you take and the physical examination you have done. It's not a good practice to now always wait for lab result before you have made your diagnosis. You must have made your diagnosis, and the lab result is just a way of you having a proof. Because if you are sued in a court, you can now have a proof that, okay, we did this. So, we're looking at the clinical manifestation. So, the most disturbing thing there is edema. You can see that this child has a swelling around the eye, swelling in the stomach, swelling on the leg. Okay, so let's move. So, edema is the most prominent. I see it around the eyes, periorbital, around the ankles, that's pedal, feet, and sometimes the swelling is everywhere. So we call that a generalized edema. The urine is foamy because the person has lost so much proteins in urine. There's weight gain due to fluid retention. The person is weak and malay, loss of appetite. The person not eating very well. It's common in children and adults. Okay, nephrotic syndrome. So the clinical manifestation of nephrotic syndrome include, okay, I'm coming back. So I'm supposed to go back. Sorry, I came and I went back. So this is, there's even, a mnemonic, but that mnemonic is nephrotic. Okay, the N is standing for what? This person is losing so much proteins, albumin. So there's low levels of albumin in the body, but that's a lab sign, not really a clinical sign. So, but lab signs do you have them? So the person is losing so much proteins in urine. So as you are losing protein, the level of protein in the blood is reducing. That's hypoalbuminemia. And your liver is trying to compensate by producing more proteins, but it also produces so much lipids, bad lipids, cholesterols, and triglycerides. And there's also what? Little blood being lost in urine because the glomerulus is being damaged. That's at the early stage. If it gets so much, it becomes so worse. So associated systemic signs include the skin changes, pallor striae, growth problems in children, hypertension may develop from fluid overload, infections because you are losing so much immunoglobulins, your immune system is becoming weak, so you are prone to all sorts of infections. So these are the clinical manifestations.